Welcome back to our series on medical assistance in dying, or MAID. Today we're taking a different angle and we're going to explore the alternatives to MAID. Are you a healthcare researcher that's always been confused about what research philosophy is? Are you ready to enhance your understanding of research philosophy? Well, I've got great news. On our learning platform at learn.methodologies.org, we just released a brand new course called Let's Talk About Research Philosophy. And in this course, we talk about 4 components: worldview, paradigm, methodology, and methods. We also talk about a 5th potential component, but I'll keep that as a surprise until you visit us and enroll in the course. Join us today and take your research expertise and practice to the next level. Learn about our courses by clicking the link below or visiting us at learn.methodologies.org. I'll see you there. Some alternatives to MAID may better align with the personal values and beliefs and cultures of an individual. And let's dive into some of these vital end-of-life choices. So the first alternative is palliative care. Palliative care is really about improving the quality of life for patients with serious medical conditions. It's not about hastening or postponing death, but providing comfort and support for physical, emotional, spiritual, and social needs. The next alternative is hospice care. Hospice care is a specialized form of palliative care for those specifically nearing the end of life. Hospice care emphasizes compassionate care, pain management, and emotional support for both patients and families. The next alternative is aggressive medical treatment or refusal of treatment. Some may choose aggressive medical treatment to prolong their life, while others may choose to refuse or withdraw treatments, allowing the natural course of illness to proceed. And finally, there is the spiritual and emotional support. Spiritual and emotional support can be vital alternatives or even complements to MAID. Whether from faith leaders, counselors, or support groups, they address the existential and emotional aspects of facing with a serious medical condition. Alternatives to MAID are multifaceted and diverse, reflecting really the complexity of end-of-life decisions. They require careful consideration, guided by personal values, medical realities, ethical beliefs, and supportive relationships. That's all I have for this week's video. Thanks for watching. If you found this video helpful, please let us know by liking, sharing, subscribing. Until the next week's video, take care. Welcome back to our ongoing series where we're delving into the concept of medical assistance in dying in MAID. Today we're going to answer some of your most pressing questions they sent on our video talking about the definitions of MAID. So let's get right into it. Are you ready to truly unlock your potential and supercharge your productivity? Join us on a brand new course we just released on learn.methodologies.org called Optimize Your Productivity: The Secret Ingredients, where we'll help you discover the keys to truly effective work. Throughout this course, you'll learn powerful strategies and skills that foster productivity. Explore our engaging video lessons on passion, metacognition, goal setting, and so much more. Let's redefine productivity, overcome challenges, and celebrate your journey to a more productive and fulfilling work-life journey. Sign up for our course today by clicking on the link below or visiting us at learn.methodologies.org, and I'll see you there. What is the difference between voluntary euthanasia and assisted suicide? Voluntary euthanasia involves a licensed healthcare provider administering a substance that directly causes the patient's death, with the patient's explicit and competent consent. In contrast, assisted suicide is when a licensed provider provides the means or the information for a patient to end their own life, but the patient must take action leading to their death. How does non-voluntary euthanasia differ from involuntary euthanasia? Non-voluntary euthanasia is the act of ending a patient's life without their explicit request, and this happens often when a patient is not competent to make this decision. Involuntary euthanasia, on the other hand, is when euthanasia is performed against the explicit will and desires of an individual in the face of explicit competent consent. So the first one is when there's no consent or consent cannot be obtained, and the second one is against the explicit wishes of the person. Both forms of euthanasia are controversial and widely considered unethical and illegal in many jurisdictions around the world. Is assisted suicide considered legal in Canada? In Canada, assisted suicide can fall under the umbrella of MAID, depending on specific circumstances and the patient's wishes. It's essential to consult Canadian legislation and guidelines to understand the precise legal parameters and conditions under which assisted suicide is permitted. Why is it crucial to differentiate between the various types of assisted death? Differentiating between the types of assisted death is vital because each carries its own ethical, legal, and medical implications. Understanding these distinctions ensures that discussions, decisions, and policies surrounding MAID are informed, accurate, and respectful of individual rights and societal values. How does Canada's stance on MAID compare to other countries? Canada's approach to MAID, encompassing aspects of voluntary euthanasia and assisted death, is progressive, at least compared to many countries in the West. However, regulations, variations, and practices vary widely across the world, with some nations allowing broader interpretations of MAID, while others having more stricter prohibitions. It's essential to understand these international perspectives to better appreciate the global discourse on assisted death. What are the ethical concerns surrounding non-voluntary and involuntary euthanasia? Both non-voluntary and involuntary euthanasia raise significant ethical concerns. The primary issues revolve around consent and the sanctity of life. Performing euthanasia without the explicit request or against an individual's exact will challenges the principle of autonomy, dignity, and respect for individual rights, making them contentious topics in the medical and ethical communities. How do providers approach the topic of assisted death with patients and their families? Providers approach the topic of MAID with sensitivity, empathy, and a commitment to informed consent. They provide comprehensive information about the options, risks, benefits, and implications of assisted death. Open communication, respecting patient autonomy, and ensuring mental and emotional support are all paramount in these discussions. We'll certainly dedicate an entire video talking about the role of healthcare professionals in MAID. So stay tuned and don't forget to subscribe to this channel and stay up to date with the most recently released videos. Are there safeguards in place to ensure the proper application of MAID in Canada? Yes, of course. So Canada has established criteria and safeguards to ensure that MAID is administered ethically and legally. These safeguards aim to protect vulnerable populations, ensure informed consent, and maintain the integrity of the medical profession. For example, and we'll definitely explore this in a future video, requesting MAID at different time points and having a second opinion to confirm whether the request is genuine and appropriate. How do religious beliefs intersect with the various forms of assisted death? Religious beliefs often play a significant role in shaping individual and societal perspectives on assisted death. Many religions have doctrines or teachings regarding the sanctity of life, suffering, and human intervention in death. While some religious groups may oppose forms of assisted death based on these teachings, others offer more nuanced perspectives. It's essential to approach the topic with respect for diverse religious views and understand that personal decisions may be deeply influenced by faith. Are there psychological assessments involved before proceeding with MAID? Yes, so psychological assessments are a crucial part of the process when proceeding with MAID. These assessments ensure that the individual is making an informed, voluntary, and competent decision. They also help to identify any underlying mental health conditions that might influence the person's request, ensuring that the decision is not the result of untreated psychological challenges. How do family members typically cope with a loved one's decision to pursue MAID? Family members' reactions to a loved one's decision to proceed with MAID can vary widely, influenced by personal beliefs, cultural backgrounds, and the nature of the illness. While some may support the decision, understanding it as a choice for autonomy and relief from suffering, others might struggle with acceptance. It's essential to provide emotional support and open communication for families navigating this difficult decision. We will, of course, dedicate an entire video and conversation about families' perspectives with MAID. So stay tuned and subscribe to this channel to stay up to date with the most recent videos. What are the primary reasons individuals might consider MAID? Individuals can consider MAID for various reasons, often deeply personal and multifaceted. Common reasons include unbearable physical or psychological suffering, a desire for autonomy in end-of-life decisions, perceived loss of dignity, or a wish to avoid prolonged suffering. It's crucial to approach each individual's reasons with empathy, understanding, and respect. How do healthcare professionals handle their personal beliefs when they might conflict with MAID practices? Healthcare professionals are trained to prioritize patient care and their autonomy. However, when personal beliefs conflict with MAID practices, professionals might experience moral distress. Many jurisdictions, including Canada, allow healthcare providers to conscientiously object to participating in MAID, provided that they refer the patient requesting MAID to another willing and skilled provider. Continuous education, peer support, and ethical discussions can also help professionals navigate these challenges. What can viewers expect in the upcoming videos in this series? You can anticipate a thorough explanation of all the complexities of MAID, including ethical considerations and the real-life implications of this decision. This series will delve into things like patient stories, healthcare professional perspectives, the legal nuances, the societal impacts, offering a holistic view on the topic. But stay tuned and make sure to subscribe to this channel to stay up to date with our weekly videos where we will be exploring this concept. But that's all I have for this Q&A. Thanks for watching. If you found this Q&A helpful, please let us know by liking, sharing, and subscribing. Until the next Q&A. Take care. Welcome back to our ongoing series where we're talking about medical assistance in dying. In this Q&A, we're going to answer some of the questions that you sent us about the history of medical assistance in dying. So let's get right into it. Are you a healthcare researcher that's always been confused about what research philosophy is? Are you ready to enhance your understanding of research philosophy? Well, I've got great news. On our learning platform at learn.methodologies.org, we just released a brand new course called Let's Talk About Research Philosophy. And in this course, we talk about 4 components: worldview, paradigm, methodology, and methods. We also talk about a 5th potential component, but I'll keep that as a surprise until you visit us and enroll in our course. Join us today and take your research expertise and practice to the next level. Learn about our courses by clicking the link below or visiting us at learn.methodologies.org. I'll see you there. First question is, how have ancient civilizations influenced the modern perspective on assisted dying? Ancient civilizations, particularly the Greek and the Romans, laid some foundational views on euthanasia. Philosophers like Seneca and Plato hinted at its acceptance under certain circumstances, while others emerging from religious doctrines opposed it. These early debates set the stage for the complex interplay of ethics, morality, legality surrounding assisted dying. What made the 20th century a pivotal era for MAID? The 20th century witnessed significant shifts on societal, ethical, and legal perspectives on MAID. The Netherlands played a crucial role by decriminalizing certain cases of euthanasia in the 1970s, sparking global debates and prompting other nations to re-evaluate their positions on assisted dying. How did the case of Sue Rodriguez impact the MAID conversations in Canada? Sue Rodriguez's case in 1993 was a landmark moment for accepting MAID in Canada. Diagnosed with ALS, Rodriguez challenged the Canadian legal framework, asserting her right to assisted death. While she didn't win her case, the national debate it ignited played a significant role in shaping subsequent discussions, legal challenges, and eventual legislation change in Canada. What was the significance of Bill C-14 in Canada's MAID journey? Bill C-14, passed in 2016, was a monumental piece of legislation in accepting MAID in Canada. It legally recognized MAID as a medical service for eligible Canadians, setting out specific criteria and safeguards. This legislation marked a significant shift, reflecting both evolving societal values and a culmination of decades of debates and legal challenges. How do historical views on MAID differ from contemporary perspectives? Historical views on MAID were often rooted in religious, philosophical, and cultural contexts, with many ancient civilizations having mixed opinions on euthanasia. Contemporary perspectives, while still influenced by these factors, are also shaped by advancements in medical ethics, patient rights, and legal frameworks. Modern debates often center on autonomy, dignity, and the balance between individual rights and societal implications. Why is it essential to understand the historical context of MAID? Understanding the historical context of MAID provides a lens through which we can appreciate the depth and the complexity of MAID conversations. It offers insight into how societal views have evolved over time, the challenges faced in different eras, and the foundational debates that have shaped current policies and practices. Were there other countries beside the Netherlands that played a significant role in the global MAID discourse during the 20th century? Yes, of course. So beside the Netherlands, countries like Belgium, Luxembourg, Switzerland have been instrumental in shaping the global discourse on MAID. Each nation's unique legal and ethical journey has contributed to the broader understanding and practices surrounding assisted death. How have religious beliefs influenced the historical trajectory of MAID? Religious beliefs have played a significant role throughout history on shaping views on life, death, and assisted dying. For instance, Christian doctrines in ancient times influenced opposition to euthanasia. In modern times, various religious groups continue to influence the debate, either supporting or opposing MAID based on their teachings. How has medical technology and advancement influenced the historical and modern perspectives on MAID? Medical advancements have both complicated and clarified the MAID discourse. As technology has improved life-extending treatments, the ethical dilemma surrounding prolonging life versus prolonging suffering has intensified. However, advancements in palliative care and understanding of diseases have also provided more clarity on end-of-life options of care. How did ancient philosophers like Seneca and Plato view euthanasia? Ancient philosophers like Seneca and Plato offered nuanced views on euthanasia. While they didn't directly advocate for it in the way modern MAID is understood, they hinted at its acceptance in specific situations, often emphasizing the alleviation of suffering or the idea of a dignified death. Their writings provide early insights into the ethical considerations surrounding life and death. How have societal values influenced the evolution of MAID over the centuries? Societal values, shaped by cultural, religious, and philosophical influences, have played a pivotal role in the evolution of MAID. As societies have grown more secular and individualistic, there has been a greater emphasis on personal autonomy and the right to determine one's end-of-life choices. This shift in values has been instrumental in the legal and ethical advancements of MAID. Were there any significant resistance or challenges faced by countries like the Netherlands when they moved to decriminalize assisted death? Yes, so when countries like the Netherlands moved to decriminalize assisted death, they faced significant challenges both domestically with their population and internationally in the global stage. Domestically, religious groups, certain medical professionals, and ethics committees raised concerns. Internationally, there was apprehension of potential misuse and the ethical implications of such a decision. The Netherlands had to establish rigorous safeguards and criteria to address these concerns. How did landmark cases like that of Sue Rodriguez influence public opinion on MAID? Landmark cases such as the one by Sue Rodriguez brought the MAID conversation to the forefront of public discourse. Such cases tended to humanize the debate, allowing people to see the real faces and stories behind the push for greater acceptance of assisted dying. As a result, these cases often led to increased public awareness, empathy, and in many instances, shifts in public opinions towards greater acceptance of MAID. Given the historical context, how do you foresee the future of MAID evolving globally? Given its historical trajectory, the future of MAID will likely see further debate, refinement in legal frameworks, and increased emphasis on patient autonomy and the safeguards in place to avoid potential misuse. As more countries grapple with the ethical and moral and legal implications of MAID, there might be a trend towards broader acceptance, a trend that we're already experiencing for the past few decades, but with rigorous criteria and safeguards. Additionally, advancements in medical technology and palliative care will play a crucial role in shaping future discourse on MAID. What can I expect in future videos given the historical backdrop we've presented? You can anticipate a deeper exploration of the nuances of MAID in this series, building upon this historical foundation that I've presented to you. This series will delve into contemporary challenges, ethical considerations, patient stories, and the future of MAID, offering a comprehensive understanding of this deeply interesting and deeply complex topic. But that's all I have for this Q&A. Thanks for watching. If you found this Q&A helpful, please let us know by liking, sharing, and subscribing. Until the next Q&A. Take care. Welcome back to our ongoing series where we're discussing medical assistance in dying. In this Q&A, I'm going to answer some of the questions that you sent us based on the last video on the legal aspects of MAID. So let's get right into it. Are you ready to truly unlock your potential and supercharge your productivity? Join us on a brand new course we just released on learn.methodologies.org called Optimize Your Productivity, The Secret Ingredients, where we'll help you discover the keys to truly effective work. Throughout this course, you'll learn powerful strategies and skills that foster productivity. Explore our engaging video lessons on passion, metacognition, goal setting, and so much more. Let's redefine productivity, overcome challenges, and celebrate your journey to a more productive and fulfilling work-life journey. Sign up for our course today by clicking on the link below or visiting us at learn.methodologies.org, and I'll see you there. How do legal frameworks for MAID differ between Canada and the United States? There's of course many differences, but I guess the most notable one is at what level MAID was legalized. MAID was legalized nationally in 2016 with Bill C-14, setting specific criteria for eligibility. In contrast, the legality of MAID in the United States varies by state, with only a select number of states and Washington, D.C. legalizing it. Furthermore, each state that has legalized it has its own set of conditions, safeguards, and criteria. What are the specific conditions under which minors can access assisted death in Belgium? In Belgium, euthanasia was extended to minors under specific circumstances, making it a unique and a controversial aspect of the legislation. Minors can access assisted death if they are in a medically futile condition of constant and unbearable physical or mental suffering. Additionally, they must demonstrate discernment, and parental consent is mandatory. How does the Netherlands' approach to MAID for minors differ from Belgium's? Both the Netherlands and Belgium allow MAID for minors, but they have age-specific conditions. In the Netherlands, minors aged 12 to 15 require parental consent, while those between 16 and 17 need parental involvement but not necessarily consent. On the other hand, any minor in Belgium requires parental consent. The primary criterion generally for both countries remains that suffering must be unbearable with no prospect of improvement. What led to the state of Victoria in Australia legalizing voluntary assisted dying in 2019? Victoria's decision to legalize voluntary assisted death in 2019 was the result of extensive public debate, consultations, and the recognition of the need for compassionate end-of-life choices. The legislation was influenced by the desire to provide individuals with autonomy over their end-of-life choices while ensuring rigorous safeguards and preventing misuse. How do legal frameworks ensure that the decision for MAID is genuinely autonomous and not influenced by external pressures? Legal frameworks typically mandate informed consent without external pressure. This often involves multiple consultations and multiple healthcare professionals, psychological assessments, and waiting periods to ensure that the decision is consistent and not impulsive. Additionally, witnesses may be required to confirm that the request is truly voluntary, and in some jurisdictions, a second medical opinion is necessary. Why do legal criteria for MAID often include stipulations about the patient's mental competence? Mental competence ensures that the individual fully understands implications of the decision and is able to make an informed choice. It's a safeguard to ensure that decisions are not influenced by untreated underlying mental health conditions, cognitive impairments, or even external pressures. How do countries address the potential ethical dilemmas of allowing MAID for minors? Countries that allow MAID for minors like Belgium and the Netherlands have stringent criteria to ensure the decision for MAID is medically and ethically sound. This includes an assessment of the minor's discernment, the involvement or the consent of parents, and multiple medical evaluations to confirm the severity and irreversibility of the condition. Given the varied legal frameworks, how do international bodies view MAID? International bodies like the World Health Organization and the United Nations don't have a unified stance on MAID, recognizing it as a matter of national sovereignty and cultural, ethical, and social values. However, they do emphasize the importance of human rights, patient autonomy, and the need for rigorous safeguards in the countries that have legalized it. How do legal frameworks address the potential misuse or abuse of MAID? Legal frameworks incorporate multiple safeguards to prevent misuse and abuse. These include strict eligibility criteria, mandatory waiting periods, multiple consultations, psychological assessments, and the involvement of more than one healthcare professional. These measures ensure that the decision for MAID is well considered, voluntary, and free from external pressures. How have global legal perspectives on MAID evolved over the past few decades? Over the past few decades, there has been a noticeable shift towards recognizing and legalizing MAID in various countries. This evolution reflects changing societal values, increased emphasis on patient autonomy, and advancement in medical ethics. However, the journey has been marked by extensive debates, legal challenges, and the continuous refinement of legislation to balance individual rights with societal and ethical considerations. How do countries without legalized MAID address end-of-life care and decisions? In countries where MAID is not legalized, end-of-life care typically focus on palliative care, which aims to alleviate pain and improve quality of life for patients with terminal illnesses. Decisions surrounding end-of-life care are guided by medical ethics, patient wishes, or sometimes by advanced directives or living wills, which specify a patient's preferences in the case they become incapacitated. What role do healthcare professionals play in the legal processes of MAID? Healthcare professionals, of course, play an important role in the MAID process. They are responsible for assessing eligibility, ensuring informed consent throughout the process, providing the necessary medical evaluations that are needed, and if all these criteria are met, administering the procedure. Their expertise and ethical considerations are essential to ensure that the process is carried out safely, compassionately, and in accordance with law. How do legal frameworks address the rights of healthcare professionals who may have conscientious objections to participating in MAID? Most legal frameworks that have legalized MAID recognize the rights of healthcare professionals to conscientiously object to participate. In such cases, professionals are typically required to refer the patient to another qualified colleague or provide other information on accessing MAID. This balance ensures patient access while respecting the personal beliefs and values of healthcare providers. How do countries monitor and ensure compliance with MAID legislation? Countries with legalized MAID often have oversight mechanisms in place, such as review boards or committees, to monitor and ensure compliance with the law. These bodies review cases, track data, and ensure that all procedures are carried out within the legal parameters. Regular reporting and periodic reviews of the legislation also help in identifying areas for improvement or refinement. Given the legal complexities surrounding MAID, how do countries educate both the public and healthcare professionals about it? Education is a crucial component of MAID. Countries have launched public awareness campaigns, have provided resources, and offer training programs for healthcare professionals. This ensures that the public is informed by their rights and options, and healthcare professionals are equipped with the knowledge and skills to navigate the legal and ethical complexities of MAID. And that was the last question, and that's all I have for this Q&A. Thanks for watching. If you found this Q&A helpful, please let us know by liking, sharing, and subscribing. Until the next Q&A, take care. Welcome back to our ongoing series where we're delving deep into the world of medical assistance in dying, or MAID. In this video, we're going to answer some of the most pressing questions that you sent us in response to our most recent video introducing medical assistance in dying. Are you confused about how to do research? Do you want to dive into the fascinating world of research methods? Join us and enroll in a course at learn.methodologies.org. We've just released a brand new course called Head-to-Head Quantitative and Qualitative Research. In this course, we'll talk about the complexity of these two research paradigms. Throughout this course, you'll learn to differentiate between the characteristics of quantitative and qualitative research and really understand these characteristics using real-life examples. Join us today and unlock your full potential as a healthcare researcher. Learn about our courses by clicking the link below or visiting us at learn.methodologies.org, and I'll see you there. Before we begin, let's define the concept. Medical assistance in dying, or MAID, is a medical practice that allows eligible individuals to request and receive assistance in ending their lives. It's a profound decision that reflects personal values, beliefs, and circumstances, and is deeply rooted in the complexities of human existence. Alright, so let's get into the questions. So the first question is, why is the subject of death considered universal yet deeply personal? Death is an inevitable part of human experience, making it universal. However, how we deal, approach, and perceive death varies based on our individual beliefs, cultural backgrounds, and personal experiences, making it a deeply personal journey for each individual. How does MAID resonate with different stakeholders like patients, families, and healthcare professionals? MAID is a decision that touches on control, relief, ethics, and empathy. For patients, it might be about autonomy and relief from suffering. Families might grapple with the emotional complexities and ethical considerations. Healthcare professionals often have to navigate between their duty to care and their personal beliefs. In the coming weeks, we'll explore how MAID impacts all the different people involved in the process. Stay tuned and don't forget to subscribe to this channel and know when the next video is released. What are some of the topics from which this series will explore MAID? This series will explore the various facets of MAID, including its basics, patient stories, family perspectives, mental health considerations, ethical debates, and the potential future developments in this field. We have a lot stored for you in this series, so stay tuned and don't forget to subscribe to this channel and be up to date on the most recent video we release. Why is it important to discuss the complexities and emotions surrounding MAID? Discussing the intricacies of MAID helps to foster understanding, empathy, and informed decision-making. By delving into its emotional and ethical dimensions, we can better support those who are considering or who are affected by MAID and ensure a holistic approach to end-of-life care. Next question is, who is the target audience for this series on MAID? This series is designed for a wide audience, including those personally affected by MAID, healthcare professionals, students, or anyone really curious about the profound decisions surrounding end-of-life choices. What is the main goal of this series on MAID? The primary goal of this series is to explore, reflect upon, and understand the multifaceted aspects of MAID. By providing comprehensive insights on this topic, this series hopes to foster informed discussions and support those navigating the complexities of MAID. How does culture influence the perception and decision-making surrounding MAID? Culture plays a significant role in shaping our beliefs, values, and attitudes toward end-of-life decisions. Different cultures may have religious, philosophical, traditional views on life death and the sanctity of human existence. These cultural nuances can either support or challenge the acceptance of MAID. It's essential to approach the topic with cultural sensitivity, recognizing that individual choices may be deeply rooted in cultural contexts. We will certainly explore this particular topic in a unique video upcoming in this series, so don't forget to subscribe and stay tuned for that video. What are some common misconceptions about MAID? Many people mistakenly believe that MAID is equivalent to giving up or an easy way out of suffering. Others might confuse it with euthanasia, not understanding the distinct legal and ethical differences. Some may also think that MAID is universally accepted among medical professionals, when in reality it remains truly a topic of debate. Addressing these misconceptions is crucial for informed discussions and decision making. How do mental health considerations play into the MAID discussion? Mental health is a critical component of the MAID conversation. Patients seeking MAID might be experiencing an immense amount of psychological distress or mental health conditions that influence the decision towards MAID. It's essential to ensure that these individuals receive comprehensive mental health assessments and support. Moreover, the emotional well-being of families and healthcare professionals involved in the process must also be considered and addressed. What are the ethical debates surrounding the practice of MAID? Yes, so MAID is a topic that sparks intense ethical debates. Some argue in favor of individual autonomy and the right to die with dignity, while others raise concerns about the sanctity of life and potential misuse. Healthcare professionals might grapple with their personal beliefs versus their professional duties. These ethical discussions are vital in shaping policies, guidelines, and societal perceptions surrounding MAID. We will explore many of these concepts in the upcoming weeks in this series. Stay tuned for future videos and don't forget to subscribe to know when the most recent video has been released. How do advancements in medical technology and research impact the MAID discourse? Medical advancements can both complicate and clarify the MAID discourse. As technology improves life-extending treatments, the line between prolonging life and prolonging suffering can get blurry. On the other hand, better palliative care techniques can offer alternatives to MAID. Continuous research and technological evolution necessitate regular visiting and updating of MAID policies and discussions. What motivated the creation of this series on MAID? The motivation behind this series is to shed light on one of life's most profound decisions, MAID. By exploring MAID from different perspectives, this series aims to foster understanding, empathy, and informed discussions, helping viewers navigate the emotional, ethical, and practical aspects of end-of-life choices. Thanks for watching this Q&A. If you found this Q&A helpful, please let us know by liking, sharing, subscribing. Until the next Q&A. Take care. Welcome back to our series on medical assistance in dying, or MAID. In today's episode, we're looking ahead to the future of MAID in the world, exploring emerging trends, ongoing debates, and recent developments, including some thought-provoking situations in Canada. Hey you, stop right there. Visit us at learn.methodologist.org, where we just released a brand new course called The Social Determinants of Health Beyond Medicine. Dive deep into the intricate factors influencing health beyond biology and genetics. From the history of the social determinants of health to present-day implications. With this course, you'll embark on a journey to understand the societal, economic, and the environmental factors that play a pivotal role in determining health outcomes. Let's make a difference and redefine health together. Learn about our courses by clicking the link below or visiting us at learn.methodologist.org, and I'll see you there. The first issue is expanding eligibility criteria. The future may see expanded eligibility criteria for MAID, including non-terminal conditions and even mental illnesses. These expansions raise complex questions about autonomy, about societal values, and about the nature of suffering. And then there's the food bank situation in Canada. And what's happening is that recently certain individuals who are accessing food bank services have applied for MAID. This situation raises profound ethical issues, highlighting the intersection between socioeconomic factors, healthcare, and end-of-life decisions. Then there is the issue of technological advancements. Technology, undoubtedly, like everything in healthcare, is influencing the future of MAID. Innovations in telemedicine and personalized care could enhance accessibility and individualized care. Finally, there is the issue of global perspectives and legal changes more broadly. The legal landscape undoubtedly is evolving around the world. More countries are considering or enacting legislation reflecting diverse cultural, religious, and political values. The future of MAID is a dynamic and multifaceted journey, reflecting the ever-changing nature of human society, of law, of ethics, and of medicine. It's a challenging yet exciting field that invites us to engage, reflect, and contribute. And that's all I have for this week's video. Thanks for watching. If you found this video helpful, please let us know by liking, sharing, subscribing. Until the next video, take care. Welcome to the journey that explores some of the most profound and personal aspects of our existence, the choices we make at the end of our lives. Hey you, stop right there. I have an amazing learning opportunity for you. Visit us at learn.methodologies.org to enroll in our brand new course called Let's Get Your Article Published. This course was designed to improve your publishing productivity and help you understand both the ins and outs of academic publishing. Join us in this course as I walk you through the entire publishing process from start to finish, from identifying the right journal and managing the peer review process. Learn about the elephant in the room: predatory journals. So let's embark on this learning journey together, and let me help you turn your research articles into published articles in journals. Learn about our courses by clicking the link below or visiting us at learn.methodologies.org, and I'll see you there. My name is Majid. I'm from The Methodologist. I'm here to guide you through an exploration of such a complex and multifaceted concept: medical assistance in dying, or MAID for short. Life is a tapestry of joy, sorrows, connections, and experiences. And at the end of this journey, we're faced with decisions that reflect our values, our beliefs, and our unique human story. Death is a universal experience, but at the same time, it's deeply personal. How we approach our end of life reflects our individuality, our culture, and our society. MAID presents a range of choices filled with complexity and emotion. It's about control, relief, empathy, and ethics. It's a decision that resonates with patients, families, healthcare professionals, and communities. In this series, we'll explore MAID from various different angles, from understanding what it is to diving in patients' experiences, families' perspectives, mental health considerations, ethical debates, and looking ahead to the future. Whether you're personally affected by this topic, a healthcare professional, a student, or simply curious about the topic, this is the series for you. I invite you to join me in this series where we together will explore, connect, and experience this complex topic. That's all I have for this week's video. Thanks for watching. If you found this video helpful, please let us know by liking, sharing, and subscribing. Until the next week's video, where we continue to talk about MAID. Take care. Welcome back to our series on medical assisted in dying, or MAID. Today we're going to explore some aspect of patients' experiences with MAID. With the evolving landscape of healthcare research, there's an escalating need to understand patient perspectives and preferences. At The Methodologists, we specialize in integrating and leading qualitative studies in your work, allowing researchers, pharmaceutical companies, or other individuals to delve into the profound narratives of patient preferences and experiences. The Methodologist is here to assist you in intertwining and integrating patient experiences and perspectives in your work. Connect with the Methodologist today, and let's pioneer a journey together to humanize research and elevate the voices that are pivotal to the design and delivery of healthcare interventions. Get in touch with us by emailing info@methodologist.org or by filling out a form on our website, www.methodologist.org/contact-us, and I look forward to hearing from you. Today's topic is deeply personal and human. It's about patient stories. Behind every decision for MAID lies a unique human story that's filled with emotions, reflections, and choices. Let's explore some aspects of these stories together. It's important to understand that every patient's journey to MAID is unique and distinct. While some see it as regaining control over their condition, others see it as a compassionate response to unbearable suffering. It's a decision that's shaped by so many different factors, including medical conditions, personal beliefs, and family dynamics. The decision to pursue MAID often involves a deep reflection of life, values, and dignity. It's a decision that may evolve over time, influenced by the progression of an illness and conversation with loved ones. Patient's decision doesn't only affect them, it resonates with family, with friends, and the broader community they're part of. Understanding and accepting this decision can be a complex process. The actual experience of MAID varies for each patient, from the setting they choose to the people they wish to have present at the moment of administration. It's a moment that encapsulates a deeply personal journey. Patient stories are at the heart and at the soul of MAID. They remind us that MAID is not just about laws or medical procedures. It's about individuals facing one of life's most profound decisions. These stories invite us to reflect, empathize, and engage with MAID at a deeply personal level. But that's all I have for this week's video. Thanks for watching. If you found this video helpful, please let us know by liking, sharing, and subscribing. Until the next week's video, take care. Welcome back to our series on medical assistance in dying, commonly known as MAID. Are you a researcher that's struggling to get your papers published in reputable journals? Are you ready to take your academic publishing game to the next level? Join us on our learning platform, learn.methodologies.org, where we just released a brand new course called Let's Get Your Article Published. This course will help you unlock the secrets of academic publishing. Throughout the course, you'll learn about effective and tested strategies that will ensure that your article gets published. We'll talk about identifying the right journals, managing the peer review process. We'll talk about predatory journals and how to avoid them. Sign up for our course today and start your journey on a path to publishing success. Learn about our courses by clicking the link below or visiting us at learn.methodologies.org. And I'll see you there. In this video, we're gonna start off with the basics by defining a few types of MAID. Voluntary euthanasia is when a physician administers a substance that causes patient's death with patient's explicit consent. The patient's voluntary and competent request is the cornerstone of this type of assisted death. Assisted suicide is when a physician or another person provides the means or the information to a patient, enabling them to end their own life. However, the patient must perform the act themselves that leads to death. Non-voluntary euthanasia involves ending the life of a patient without their explicit consent. It's controversial and illegal in many jurisdictions, including Canada. And finally, involuntary euthanasia is when euthanasia is performed against the explicit will and consent of a competent individual and is widely considered unethical and illegal around the world. In Canada, MAID can encompass voluntary euthanasia and assisted suicide, depending upon the circumstances and the patient's wishes. It's important to have these four definitions in mind as we delve deeper into the complexity of medical assistance in dying. Now, that's all I have for this video. Thanks for watching. If you found this video helpful, please let us know by liking, sharing, and subscribing. And until the next week's video, take care. Welcome back to our series on medical assistance in dying, or MAID. Today we're going to explore a perspective that's often deeply intertwined with the patient's experience, and that's the family's perspective. Are you a healthcare researcher that's always been confused about what research philosophy is? Are you ready to enhance your understanding of research philosophy? Well, I've got great news. On our learning platform at learn.methodologies.org, we just released a brand new course called Let's Talk About Research Philosophy. And in this course, we talk about four components: worldview, paradigm, methodology, and methods. We also talk about a fifth potential component, but I'll keep that as a surprise until you visit us and enroll in the course. Join us today and take your research expertise and practice to the next level. Learn about our courses by clicking the link below or visiting us at learn.methodologist.org. I'll see you there. The decision to pursue MAID doesn't only affect the individual, it has a profound impact on families and loved ones. Let's dive into this complex and emotional aspect. When a loved one chooses MAID, family members must grapple with understanding and accepting this profound decision. It's a process that's naturally filled with mixed emotions, including empathy, confusion, grief, and in some cases, relief. Families often play a vital role in the MAID process. From discussing the decision to being present in the procedure, their involvement can provide support and comfort, but may also present emotional challenges. Family members may face their own ethical and moral questions regarding MAID. Religious beliefs, cultural norms, and personal values can influence their perspectives and their reactions. Open and honest communication is crucial with the family. Difficult conversations about MAID require empathy, sensitivity, and sometimes professional guidance and counseling. The family perspective on MAID is rich, it's complex, and it's deeply human. It reminds us that MAID is not an isolated decision, but a shared experience that reverberates through the intricate relationships that define our lives. But that's all I have for this week's video. Thanks for watching. If you found this video helpful, please let us know by liking, share, subscribing. Until the next week's video, take care. Welcome back to our series on medical assistance in dying, or MAID. Today's topic takes us into the complex intersection between mental health and MAID. It's a delicate and multifaceted issue that challenges our understanding of autonomy, of suffering, of recovery, and of compassion. Let's explore mental health and MAID together. With the evolving landscape of healthcare research, there's an escalating need to understand patient perspectives and preferences. At the Methodologists, we specialize in integrating and leading qualitative studies in your work, allowing researchers, pharmaceutical companies, or other individuals to delve into the profound narratives of patient preferences and experiences. The Methodologist is here to assist you in intertwining and integrating patient experiences and perspectives in your work. Connect with the Methodologist today, and let's pioneer a journey together to humanize research and elevate the voices that are pivotal to the design and delivery of healthcare interventions. Get in touch with us by emailing info@methodologist.org or by filling out our form on our website, www.methodologist.org/contact-us, and I look forward to hearing from you. The first issue is assessing mental health competence, and as you've seen in previous videos, mental competence is a cornerstone of MAID. Assessing competence in individuals who have mental health conditions can be very challenging, requiring specialized expertise and thoughtful and careful consideration. The next issue is mental health or an illness being a qualifying condition for MAID. Some jurisdictions allow mental illness as the sole underlying condition for MAID, while others exclude them. This distinction raises profound questions about the nature of human suffering and the potential for recovery. The inclusion of mental illness as a qualified condition for MAID has sparked intense debate. It's a conversation that's filled with strong opinions, ethical dilemmas, and genuine concerns of potential misuse. Finally, there's the issue of support systems and alternatives. Exploring support systems, alternatives, and therapies is essential for when considering MAID for mental health conditions or illnesses. Comprehensive medical care can provide paths to recovery and must be considered before pursuing MAID. The relationship between mental health and MAID is a delicate and intricate subject. It invites us to reflect on our values, our understanding of mental health, and our compassion for those seeking control and relief of their suffering. But that's all I have for this week's video. Thanks for watching. If you found this video helpful, please let us know by liking, sharing, subscribing, and until the next week's video, take care. MAID is a profound and important decision, and it has multiple layers of scrutiny to ensure both patients' genuine wish and their safety. But how does this process unfold? Let's talk about it step by step. Are you eager to unravel the complexities of qualitative research? Enroll in our course today at learn.methodologist.org titled Qualitative Inquiry: An Introduction for Everyone. In this course, we'll navigate through the rich landscapes of qualitative research methodologies. You'll learn to distinguish qualitative research from its quantitative counterpart, explore real-world applications of qualitative research methodologies, and grasp why a qualitative approach is essential for nuanced and context-rich solutions. Sign up today and elevate your research capabilities to new heights. Learn about our courses by clicking the link below or visiting us at learn.methodologist.org, and I'll see you there. In Canada, once an individual makes a decision to proceed with MAID, they must make a formal written request. This request must be witnessed by at least 2 independent witnesses who also confirm the patient's voluntariness and eligibility. These individuals cannot stand to benefit from the patient's death, ensuring an unbiased perspective. Following this written formal request, there's a reflection period. This allows the individual who made the decision ample time to consider their dedication and ensure that the decision is not impulsive. However, in cases where the patient's death is imminent or there's a loss of capacity that's imminent, this period of time can be shortened. 2 independent medical assessments are then conducted by different healthcare professionals, usually physicians or nurse practitioners. They evaluate the patient's eligibility based on the established criteria, such as the severity of the medical condition and the patient's mental competence. If the patient meets all the criteria, the next step is to discuss with the patient both the risks and the benefits of proceeding with MAID, and available alternatives like palliative care. This process ensures that the patient is making an informed decision. Once everything is in order and the patient still wishes to proceed with MAID, a date is set. The patient can then choose a location, be at home, be at the hospital, or another setting. On the chosen day, the healthcare professional administers the medication, either orally or intravenously, leading to the patient's passing. It's important to note that at every step of the process, the patient has the right to withdraw from MAID at any time point. This autonomy ensures that they maintain control over their decision throughout the process. But that's all I have for this week's video. Thanks for watching. If you found this video helpful, please let us know by liking, sharing, and subscribing. Until the next week's video, take care. MAID is more than just a medical or legal issue. It's deeply rooted in an ethical debate. Are you a healthcare researcher that's always been confused about what research philosophy is? Are you ready to enhance your understanding of research philosophy? Well, I've got great news. On our learning platform at learn.methodologist.org, we just released a brand new course called Let's Talk About Research Philosophy. And in this course, we talk about 4 components: worldview, paradigm, methodology, and methods. We also talk about a 5th potential component, but I'll keep that as a surprise until you visit us and enroll in our course. Join us today and take your research expertise and practice to the next level. Learn about our courses by clicking the link below or visiting us at learn.methodologist.org. I'll see you there. The decision to end one's life with medical assistance brings forth a myriad of questions that have been debated for centuries. At the heart of this medical debate is the principle of autonomy. And this principle really says that every individual has the right to make their own decision that affects their body and their life. Proponents argue that MAID essentially extends the principle of autonomy, allowing individuals to choose a dignified end to their suffering. They believe that under specific circumstances, MAID is a compassionate response to unbearable pain or suffering. On the other hand, many oppose MAID based on the sanctity of life principle. For them, life is inherently valuable and should be preserved at all costs. Religious beliefs often play a significant role in this perspective. For example, teachings from Christianity, Judaism, and Islam emphasize the sacredness of life and view its termination morally unacceptable. Beyond religious beliefs, there's also the slippery slope argument. Some fear that legalizing MAID will eventually lead to legalizing non-voluntary and even in some cases involuntary euthanasia, especially for vulnerable populations. They worry about the potential for misuse and the devaluation of life in society. Furthermore, there's the role of the medical professional. Is it ethically right for them to participate in the ending of life, even if it's requested? This question challenges the very core of medical ethics, especially conflicting a foremost medical ethical principle of do no harm. As we navigate this series on MAID, it's important to keep an open mind. Ethical considerations surrounding MAID are complex, multifaceted, and deeply personal. They challenge us to reflect on our values and beliefs and the very essence of what it means to live and die with dignity. And that's all I have for this week's video. Thanks for watching. If you found this video helpful, please let us know by liking, sharing, and subscribing. Until next week's video, take care. Throughout history, the concept of assisted dying has been both practice and debate, revealing deep-seated beliefs about life, suffering, and autonomy. The journey of MAID is a tapestry woven with ethical, legal, and moral threads that have evolved over time. In the academic and the not-for-profit world, research can be a slow, painstaking process, sometimes taking years to complete. But in the real world, decisions need to be made within months, not years. The traditional academic research model is not designed to meet pressing demands. So at the methodologist, we ask why we should wait years for evidence to inform our policies and strategies. We think that's not appropriate. At the methodologist, we're redefining research norms and delivering high quality findings at a pace unheard of in the academic world. Start your expedited journey and get evidence that you need quickly by emailing us at info@methodologist.org or by filling out a form on our website www.methodologist.org/contact-us. Ancient civilizations like the Greeks and the Romans had varied views on euthanasia. While some philosophers like Seneca and Plato hinted at its acceptance in specific situations, others influenced by Christian doctrines opposed it. Fast forward to the 20th century, which was a pivotal era for MAID. The Netherlands became a forerunner in the 1970s, decriminalizing certain cases of euthanasia. This move ignited global debates and led other nations to consider their stances on MAID. In Canada, the conversation about MAID really gained momentum in the late 20th century and the early 21st century. Landmark cases like that of Sue Rodriguez in 1993 challenged the Canadian legal framework on MAID. It wasn't until 2016, with the passing of Bill C-14, that MAID became a legal medical service for eligible Canadians. The historical backdrop is essential for our understanding of MAID. It not only shows how societal views on MAID have shifted over time, but also underscores the ongoing nature of this conversation. As we move forward in this series on MAID, remember that our exploration is built on centuries of debate and reflection. And that's all I have for this week's video. Thanks for watching. If you found this video helpful, please let us know by liking, sharing, subscribing. Until the next week's video, take care. MAID is deeply rooted in legal frameworks that tend to vary across countries. To understand the global landscape of MAID, let's explore the legal boundaries of MAID in a few countries. Are you ready to truly unlock your potential and supercharge your productivity? Join us on a brand new course we just released on learn.methodologist.org called Optimize Your Productivity: The Secret Ingredients, where we'll help you discover the keys to truly effective work. Throughout this course, you'll learn powerful strategies and skills that foster productivity. Explore our engaging video lessons on passion, metacognition, goal setting, and so much more. Let's redefine productivity, overcome challenges, and celebrate your journey to a more productive and fulfilling work-life journey. Sign up for our course today by clicking on the link below or visiting us at learn.methodologist.org, and I'll see you there. So in Canada, MAID was legalized in 2016 with the passing of Bill C-14. Eligible individuals must be adults, mentally competent, and have a grievous and irremediable medical condition. Informed consent without external pressures is mandatory. In the United States, MAID legality varies by the state. At least 9 states, including Washington, D.C., have legalized assisted death. Typically, patients must be adults, terminally ill with 6 months or less to live, and mentally competent. And now let's move on to Belgium, where euthanasia was legalized in 2002. Certain kinds of euthanasia are available for adults in Belgium, and controversially, for also minors with parental consent under specific circumstances. To be eligible, patients must be in a medically futile condition of constant and unbearable physical or mental suffering. Now in Netherlands, euthanasia and physician-assisted death was formally legalized in 2002. And this is available for both adults and minors with age-specific conditions. To be eligible, suffering must be unbearable without any prospect for improvement. And finally, the last country we'll explore is Australia, where the state of Victoria legalized assisted death in 2019, with other states following suit or considering legislation. In Australia, patients must be adults with an incurable illness causing unbearable suffering and expected to live for less than 6 months or less than 12 months for neurodegenerative conditions. As you can see that countries, while they have similar commonalities between their legal frameworks for MAID, there are certain differences. And these certain differences possibly reflect diverse cultural, ethical, and social values. And that's all I have for this week's video. Thanks for watching. If you found this video helpful, please let us know by liking, sharing, and subscribing. Until the next week's video, take care. Welcome back to our series on medical assistance in dying, or MAID. Today we're going to explore the role of healthcare professionals a little bit more deeply. Are you a healthcare researcher that's always been confused about what research philosophy is? Are you ready to enhance your understanding of research philosophy? Well, I've got great news. On our learning platform at learn.methodologies.org, we just released a brand new course called Let's Talk About Research Philosophy. And in this course, we talk about 4 components: worldview, paradigm, methodology, and methods. We also talk about a 5th potential component, but I'll keep that as a surprise until you visit us and enroll in the course. Join us today and take your research expertise and practice to the next level. Learn about our courses by clicking the link below or visiting us at learn.methodologies.org. I'll see you there. First, let's talk about assessment. Healthcare professionals like physicians and nurse practitioners are the ones who determine if a patient is eligible for MAID. They must be thorough, compassionate, and unbiased. It's a delicate task that requires a great amount of care. Next, there's guidance and counseling. Imagine walking alongside patients and families, answering their questions and their concerns, and providing emotional support throughout the process. It's about understanding, it's about empathy, and it's about ensuring that the decision is well informed. Another role of healthcare professionals is the administration of medication. The administration of medication is a profound moment. It is handled with the utmost respect for the patient's dignity. Healthcare professionals are there to provide a peaceful and respectful experience. Then there's the issue of conscientious objection. Not all healthcare professionals will feel comfortable in administering MAID. In Canada, physicians have the right to conscientious objection. It is a balance between personal beliefs and professional responsibilities, and it's a vital part of the process. Another role of healthcare professionals is documentation and reporting, and for this, transparency is key. Detailed documentation and reporting ensures the process is carried out legally and while it's a behind-the-scenes task, it is so essential. Next is ethical considerations and the emotional impact MAID can have on healthcare professionals. MAID can weigh heavily on some healthcare professionals. They must navigate ethical dilemmas and the emotional impact it has on them. Support from both peers and having counseling service available are essential in navigating this impact. The role of the healthcare professional in MAID is the complex dance of compassion, ethics, and humanity. Their dedication shapes their journey, and I hope that this video has given you some insight into their world. But that's all I have for this week's video. Thanks for watching. If you found this video helpful, please let us know by liking, sharing, and subscribing. Until the next week's video, take care. Welcome back to our series on medical assistance in dying, or MAID. Today we're going to conclude our long journey exploring MAID by discussing its future. Are you a healthcare researcher that's always been confused about what research philosophy is? Are you ready to enhance your understanding of research philosophy? Well, I've got great news. On our learning platform at learn.methodologies.org, we just released a brand new course called Let's Talk About Research Philosophy. And in this course, we talk about 4 components: worldview, paradigm, methodology, and methods. We also talk about a 5th potential component, but I'll keep that as a surprise until you visit us and enroll in the course. Join us today and take your research expertise and practice to the next level. Learn about our courses by clicking the link below or visiting us at learn.methodologies.org. I'll see you there. We have journeyed to understand MAID from different angles, from both definitions and legal frameworks to the role of healthcare professionals and patient and family perspectives. When thinking about the future of MAID, it's important to consider the following points. The first is balancing individual autonomy and societal responsibilities. How do we respect personal choices while considering the broader implications of MAID for our communities? The second point is the role of medical professionals. Healthcare professionals are at the forefront of MAID, constantly navigating ethical dilemmas, professional obligations, and personal beliefs. Their role is multifaceted and will continue to evolve and become complex. The third point is cultural and religious perspectives. Cultural and religious beliefs undoubtedly influence attitude towards MAID, both at an individual level as well as a societal level. Understanding and respecting these diverse perspectives is essential for a pluralistic society. And finally, the fourth point is education, dialogue, and public policy. Educating the public, fostering an open dialogue, and developing thoughtful public policies are vital for an informed and compassionate approach to MAID. It's a collective effort that requires engagement from all sectors of society. Ethical considerations and the societal impact of MAID invites us to what it means to live, to die, and to make profound decisions in a complex world. It's a conversation that reaches into the core of our values and our shared human experience. But that's all I have for this video and this series on MAID. Thanks for joining me as we talked about MAID from different angles. My name is Majid. I'm from The Methodologist. If you found this series helpful, please let us know by liking, sharing, and subscribing. And until the next video in the next series, take care. MAID isn't a decision that should be taken lightly. It's governed by stringent eligibility criteria to ensure that the process is both ethical and safeguarded from potential misuse. But what exactly are these criteria? And we'll talk about some with the example of Canada. Are you a healthcare researcher that's always been confused about what research philosophy is? Are you ready to enhance your understanding of research philosophy? Well, I've got great news. On our learning platform at learn.methodologies.org, we just released a brand new course called Let's Talk About Research Philosophy. And in this course, we talk about 4 components: worldview, paradigm, methodology, and methods. We also talk about a 5th potential component, but I'll keep that as a surprise until you visit us and enroll in the course. Join us today and take your research expertise and practice to the next level. Learn about our courses by clicking the link below or visiting us at learn.methodologies.org. I'll see you there. In Canada, as established by Bill C-14 and subsequent amendments, the criteria for MAID eligibility are both clear and rigorous. Firstly, the individual applying for MAID must be eligible to receive health services funded by the federal government or a province or territory. This ensures that the process is not misused for those seeking to end their life for reasons unrelated to health. Age factor is also pivotal. Only adults aged 18 or older who are capable of making decisions about their health can request MAID. This age restriction ensures that the decision for MAID is both mature and well considered. Furthermore, the decision for MAID must be voluntary, made without external pressures or influence. This is crucial to ensure that the individual genuinely wishes to end their life and isn't being coerced into it. Next, the individual's health condition plays a central role. They must have a grievous or irremediable medical condition. This means that they have a serious illness, disease, or disability, are in an advanced state of decline, and face unbearable mental or physical suffering. Furthermore, their natural death must be reasonably foreseeable. foreseeable. Finally, mental competence is another cornerstone of MAID. The individual must be able to understand the information relevant to their decision and the foreseeable consequences of either undergoing or not undergoing MAID. It's worth noting that while these criteria I shared are specific to Canada, other countries with legalized MAID have similar practices and similar eligibility criteria that reflect their unique cultural, ethical, and social values. But that's all I have for this week's video. Thanks for watching. If you found this video helpful, please let us know by liking, sharing, and subscribing. Until the next week's video,